Hi, my name is Elizabeth Shade and I'm a nurse practitioner in Philadelphia, and again I want to welcome you to our discussion about treatments for urinary incontinence. Today we're going to talk about timed voiding. Timed voiding is setting a schedule for when you're going to urinate that will best keep you as dry as possible. The first thing you want to do when you're setting up a timed voiding plan is to keep a schedule or a diary of your normal bladder function. We'll want to keep this diary for 3 days. You'll want to mark down in the diary the time of day when you, number 1, drink anything, and you'll want to write down the substance that you drink. Number 2, eat anything, and you should write down the things that you're eating. Number 3, you want to mark down whenever you urinate. Number 4, you want to mark down when you move your bowels. And number 5, you want to mark down whenever you have an incontinent episode. In addition, along with each of those items, you want to mark down if there's anything significant that you want to note. So for example, if you were to have an incontinent episode, you'd want to mark down what activity you were doing when that happened. Did it happen when you had a coughing spell or when you were exercising? Or did it happen when you were carrying groceries and walking in the front door of your house and you put the key in the front door? We call that the key in the door syndrome. And it's a very common time for people to have increased urgency or even loss of urine. So you want to keep that diary for about 3 days. And then you want to look at that diary and you want to identify what is the best interval that you could set a timed every day, however, hour and a half, 2 hours, 2.5 hours, whatever it's going to be, that would keep you the most dry to eliminate having incontinent episodes. And then you want to start just urinating according to that schedule. Rather than waiting for the urge to urinate, you want to watch the clock. And if you've decided that your voiding interval is going to be every hour and a half, then every hour and a half, whether you feel the urge or you don't feel the urge, you just go in the bathroom and you sit down and you try to empty your bladder. What's also important is that when you do go into the bathroom, you want to make sure that you're emptying your bladder as completely as possible. And we call that double voiding. And the way you do double voids is when you're sitting on the toilet, you empty your bladder, and when you feel like you're finished, you stand up from the toilet and then you sit right back down. And then you lean forward, resting your elbows on your knees, and just count to 5 and see if any more urine comes out. If no more urine comes out after doing this for a few days, then you probably don't need double voiding. But if you find that any of these positional changes cause you to have more urine to flow, then you should use double voiding to help you to get as much urine out and to decrease that post-void residual urine as much as possible. Good luck.